Good morning, class. In our previous meeting, our topic was about what is inner peace and how do we achieve it. Just in case you forgot, inner peace refers to a state of being mentally and spiritually at peace despite the presence of stressors. It means you feel happy, content, and peace no matter how hard you go through in life. Lastly, inner peace is subjective. To some, simple things like traveling, eating, and playing makes them feel at peace. Well, for me, I feel at peace when I'm sleeping. It's like other people. Also, we discussed how we can achieve inner peace by developing good habits and through self-care. And so today, we will be focusing more on issues related to inner or personal peace, like what happens when you fail to achieve inner peace. Under it are three topics. First is stress, second is depression or self-harm, and last but not the least is alienation, low self-esteem, and anxiety. So we will be starting with the first topic, stress, which will be reported by Miss Shifra Dea Alinio. A round of applause, please.
Who is affected by stress? All of us. Some of the sensations I mentioned above are likely familiar to all of us. Some people appear to be more stressed than others. Getting out to the door on time each morning can be a stressful experience for some individuals, while others may be less impacted. Some people are more likely to experience stressful situations than others. For example, people who have a lot of debt or financially insecure are more likely to be financially worried. People who are LGBTIQ+ or from minority ethnic groups are more likely to be stressed by prejudice or discrimination. People with disabilities or chronic illness are more likely to be concerned about their health or the stigma connected with their condition. Stress. The sensation of being overwhelmed or unable to deal with mental or emotional pressure is known as stress. Stress may be caused by a variety of conditions or life events. It is frequently triggered when we encounter something new, unexpected, or that challenges our sense of self, or when we feel powerless over a situation. We all handle stress in various ways. When we are stressed, our bodies release stress hormones that stimulate our immune system and provoke a fight or flight reaction. These allow us to react faster in potentially harmful circumstances. This stress reaction can be beneficial in some situations, such as when we need to push through fear or pain in order to run a marathon or give a speech. When a stressful incident is over, our stress hormones normally return to normal quickly with no long-term consequences. However, excess stress might have damaging consequences. It might put us in a constant state of fight or flight, leaving us feeling overwhelmed or helpless. This can have a long-term impact in our physical and emotional health. Stress is a normal feeling. There are two main types of stress: acute stress and chronic stress. Acute stress. This is short-term stress that goes away quickly. When you slam on the brakes, quarrel with your spouse, or ski down a steep hill, you feel it. It assists you in dealing with potentially risky circumstances. It might also happen if you try something new or intriguing. At some point in our lives, everyone experiences acute stress. Chronic stress. This is stress that lasts for a longer period of time. If you have money troubles, an unpleasant marriage, or employment problems, you may be suffering from chronic stress. Chronic stress is defined as any sort of stress that lasts for weeks or months. Chronic stress might become so habitual that you aren't even aware it's an issue. Stress may lead to health problems if you don't learn to control it. What makes us stress? Stress can be caused by a variety of factors, including grief, divorce or separation, job loss, or sudden financial difficulties. Stress at work may also be harmful to your mental health. Workplace stress causes people to miss an average of 24 days of work each year due to illness. Even positive life changes like moving into a larger house, getting a work promotion, or going on vacation can cause stress. If you're anxious in certain situations, You might have a hard time understanding why, or you might be hesitant to communicate your feelings with others. What are the signs of stress? You may feel anxious, afraid, angry or aggressive, sad, irritable, frustrated, or depressed. This feeling can sometimes produce physical symptoms, making you feel even worse. If you're stressed, you may experience headaches, nausea, indigestions, digestive problems such as constipation, bloating or diarrhea, shallow breathing or hyperventilating, sweating, heart palpitations, aches and pains. How you might behave. You may behave differently if you're stressed. You may withdraw from other people or snap at them. Be indecisive or inflexible. Be tearful. Have problems getting to sleep or staying asleep. Experience sexual problems. Smoke, drink alcohol, or take drugs more than usual. If the stress is long-term, you may notice changes in your sleep and memory, as well as changes in your eating habits and decreased desire to exercise. Long-term stress has also been related to gastrointestinal problems, including irritable bowel syndromes or stomach ulcers, as well as cardiovascular illness, according to certain studies. Who is affected by stress? All of us. Some of the sensations mentioned above are likely familiar to all of us. Some people are more likely to experience stressful situations than others. For example, people who have a lot of debt or are financially insecure are more likely to be financially worried. People who are part of the LGBTIQ plus community or from minority ethnic groups are more likely to be stressed by prejudice or discrimination. People with disabilities or chronic illnesses are more likely to be concerned about their health or the stigma connected with their condition. How can you help yourself? If you're feeling stressed, there are some things you can try to feel less tense or overwhelmed. Number 1. Recognize when stress is a problem. Consider what's causing you to be stressed. Sort them into 3 categories. Difficulties with practical remedy, things that will improve with time, and things you can't change. Take charge by making minor changes to the areas where you can improve. Make a strategy for dealing with issues that you have control over. Setting realistic expectations and prioritizing vital commitments are examples of this. If you're feeling overwhelmed, seek assistance and decline tasks you can't do. Number 2. Think about where you can make changes. Do you think you're taking on too much? Could you pass some items on to someone else? Can you take your time? You may need to reorganize your life and prioritize your tasks so that you're not attempting to complete everything at once. Number 3. Build supportive relationships. Find close friends or family members who can give assistance and practical guidance to help you manage stress. Joining a group or taking a class can help you broaden your social network while also encouraging you to try new things. Volunteering, for example, can improve your viewpoint and improve your attitude. Number 4. Eat healthily. A good diet can help you feel better. Drinking enough water and getting enough nutrients, including key vitamins and minerals, might improve your mental health. Number 5. Be aware of your smoking and drinking. If you can, reduce or stop smoking and drinking. They may appear to relieve tension, but they really actually worsen issues. Caffeine and alcohol might make you feel more anxious. Number 6. Get some exercise. Physical activity can help you cope with stress by releasing endorphins, which improve your mood. When you're anxious, it might be difficult to inspire yourself, but even a small amount of action can help. For example, 3 times a week, you may attempt to walk for 15 to 20 minutes. Number 7. Take time out. Take some time to rest and exercise self-care, which involves in doing activities that are good for you. You may, for example, listen to relaxation podcasts to relax your body and mind. In order to reduce stress, you must strike a balance between your responsibilities to others and your responsibilities to yourself. Number 8. Be mindful. Mindfulness meditation may be done at any time and in any place. It has been shown in studies to be effective in controlling and lowering the effects of stress and anxiety. Number 9. Get some restful sleep. If you're having trouble sleeping, consider cutting down on your coffee intake and avoiding too much screen before bed. Make a to-do list for the next day to help you prioritize. but put it away before going to bed. Number 10. Be kind to yourself. Don't be too harsh on yourself and try to keep things in perspective. Look for the good aspects of your life and list down things for which you are thankful. Number 11. Get professional help. If you're still feeling stressed out, don't be afraid to seek professional assistance. This does not imply that you are a failure. Number 11. Get professional help. If you're still feeling stressed out, don't be afraid to seek professional assistance. Share your feelings with your doctor. They should be able to provide therapy recommendations and maybe refer you to additional assistance. They may suggest talking therapy such as cognitive behavioral therapy, which can help reduce stress by changing the ways you think about stressful situations, and brief interpersonal counseling, which can give you the chance to talk about what causes you to be stressed and develop coping strategies.
What is depression? Depression is a frequent and serious medical condition that has a negative impact on how you feel, think, and act. Depression produces sadness and/or a loss of interest in previously enjoyed activities. It can cause a slew of mental and physical issues, as well as a reduction in your capacity to operate at work and at home. In any given year, depression affects about 1 in every 15 persons. 1 in every 6 people will suffer from depression at some point in their lives. Depression can strike at any age, but it is most common in late adolescence and early adulthood. Women are more prone to suffer from depression than men. According to some research, 1/3 of women will have a significant depressive episode over their lives. When first-degree relatives suffer from depression, there is a high degree of heritability. Depression is different from sadness or grief. Being sad is not the same as having depression. The grieving process is natural and unique to each individual and shares some of the same features of depression. Both grief and depression may involve intense sadness and withdrawal from usual activities. They are also different in important ways. Depression is different from sadness or grief. Being sad is not the same as having depression. The grieving process is natural and unique to each individual and shares some of the same features of depression. Both grief and depression may involve intense sadness and withdrawal from usual activities. They are also different in important ways. It's essential to distinguish between grieving and depression so that people can obtain the aid, support, and treatment they require. Risk factors for depression. Depression can affect anyone, even a person who appears to live in relatively ideal circumstances. Several factors can play a huge role in depression. Biochemistry. Differences in certain chemicals in the brain may contribute to symptoms of depression. Genetics. Depression can run in families. For example, if one identical twin has depression, the other has a 70% chance of having the illness sometime in life. Personality. People with low self-esteem who are easily overwhelmed by stress or who are generally pessimistic appear to be more likely to experience depression. Environmental factors. Continuous exposure to violence, neglect, abuse, or poverty make some people more vulnerable to depression. What causes depression? The 4 major causes of depression are family history, illness and health issues, medication, drugs and alcohol, and personality. In family history, if your family members have had depression, you are more likely also to experience depression. In illness and health issues, physical illness or injuries can have a significant impact on your mental health. Chronic health issues, long-term health issues, or physical health issues that drastically change your lifestyle can cause depression. In medication, drugs, and alcohol, many different medications can have the unfortunate side effects of depression. Personality. Some people and personalities are just more to experience depression. For example, people who tend to hold in worries and stress, have low self-esteem, are perfectionists, and sensitive to criticism are naturally more likely to be depressed. It has been found through research that life events can increase your chances of being depressed. Examples of events like this include losing your job, being in a dysfunctional relationship, stress at work, isolation, going through a breakup or divorce, being diagnosed with an illness, being unemployed for a long time, and lastly, grieving a loved one. While negative life events can cause depression, they don't necessarily always cause it. Often, it is more about how you deal with these difficult situations. Feeling down most of the time can lead to depression. Depression symptoms can vary from mild to severe and can include feeling sad or having a depressed mood, loss of interest or pleasure in activities once enjoyed, changes in appetite, weight loss or gain unrelated to dieting, trouble sleeping or sleeping too much, loss of energy or increased fatigue, increase in purposeless activity or slowed movements or speech, feeling worthless or guilty, difficulty thinking, concentrating, or making decisions, thoughts of death or suicide. Symptoms must last at least 2 weeks and must represent a change in your previous level of functioning for a diagnosis of depression. Also, medical conditions, for example, thyroid problems, a brain tumor, or vitamin deficiency, can mimic symptoms of depression, so it is important to rule out general medical causes. Treatments for depression. Self-guided changes to your lifestyle. Simply changing things like your sleep cycle, how you spend your time, and other daily habits can do a lot to improve your depression. Therapy. Beginning counseling or therapy can help you better cope with your feelings and talk them through. You can do therapy for a short time or stay in it for more extended periods of time. Alternative therapies. Many people with mild depression can heighten their experience by supplementing it with acupuncture or hypnosis. Brain stimulation. For people who suffer from severe depression, brain stimulation can be beneficial. What is self-harm? Self-harm is defined as any behavior in which a person intentionally harms himself, usually to cope with uncomfortable or distressing thoughts and feelings. Cutting, burning, and non-lethal overdosing are the most common methods of self-harming. It is also defined as any behavior that causes hurt or injury to another person as a means of coping with tough emotions. The self-harm cycle. Self-harm is frequently initiated as an attempt to relieve the pressure that has built up as a result of upsetting thoughts and sensations. This may provide brief alleviations from the person's mental distress. It's essential to understand that discomfort is only brief. as the fundamental causes persist. Feelings of guilt and humiliation may follow soon after. The picture shown is the self-harm cycle. Since there may be some temporary relief at the start, self-harm can become someone's normal way of dealing with life difficulties. This means that it is important to talk to someone as early as possible to get the right support and help. Learning new coping strategies to deal with these difficulties can make it easier to break the cycle of self-harm in the long term. There is no such thing as a typical self-harming adolescent. Self-harm can strike anyone at any time. Self-harm is estimated to affect roughly 10% of young individuals, but it could be as high as 20%. There are many people who understand what you're going through if you self-harm. The majority of young individuals said they began injuring themselves around the age of 12. While it is true that anyone can be affected by self-harm, some people are more likely to self-harm than others because of things that have happened in their lives, where they live, things that are happening with friends, family, or at school, or a combination of this. Why do people self-harm? Various things induce tension and concern for different people. Some people may cope with their problems by talking to their friends and family, but others may find them overwhelming. The pressure can build up and become unbearable if we don't express our feelings and talk about what makes us sad, angry, or upset. Some people turn in on themselves and use their bodies to express the ideas and feelings they are unable to articulate verbally. When it all becomes too much for somebody, they frequently injure themselves. If you self-harm, you may find that you feel compelled to damage yourself even more when you are angry, distressed, worried, or depressed. Triggers or reasons that lead them to self-harm include difficulties at home, arguments or problems with friends, school pressure, bullying, depression, anxiety, low self-esteem, transitions and changes, alcohol and drug use. When a few of these issues come together, they can quickly feel overwhelming and become too much for one person to deal with. They lead into hurting themselves because they didn't know what else to do and didn't feel like they had any other options. Signs to look out for. It's not always easy to discern if someone is self-harming, so here are some signs that might suggest someone could be self-harming. Withdrawal or isolation from everyday life. Signs of depression, such as low mood, tearfulness, or a lack of motivation or interest in anything. Changes in mood, changes in eating or sleeping habits, changing in activity and mood, talking about self-harming or suicide, abusing drugs or alcohol, expressing feelings of failure, uselessness, or loss of hope. Risk-taking behavior, signs of low esteem, such as blaming themselves for any problems or saying they are not good enough. Unexplained cuts, bruises, or marks. Covering up all the time when in hot weather. Being quieter than usual and lacking energy. It is important to know that this may be a sign of other things and that always means someone is self-harming. Also, there may be no warning signs at all. It is therefore important that if you suspect someone you know is self-harming, you should ask them openly and honestly. Distraction techniques. When you feel the urge to self-harm, distraction techniques can be a useful way to ride the wave of emotion and overcome the urge to harm yourself. Write down thoughts and feelings that are distressing you. Crumple the page up, rip it apart, and throw them out as a way of letting go of the thought of hurting oneself. Get some Play Doh, stretch it or squeeze it to relieve some tension, hit a pillow or cushion to vent your anger and frustration, have a good scream into a pillow or cushion, take a minute and breathe or meditate. Go for a walk to take yourself away from triggers. Being in a public place gives you time and space to reduce the urge to hurt yourself. Make a lot of noise, either with a musical instrument or just banging on pots and pans. Scribble on a large piece of paper with a red crayon or pen. Call a friend or a family member and talk to them. This doesn't have to be about self-harm. Do something creative. Make a collage of colors to represent your mood or to remind you of your favorite things. Listen to music you like or watch a film you enjoy. Talk to someone about what is triggering you or seek help from a professional. The most helpful to recovery was the 5 minutes rule, where if you feel like you want to self-harm, you wait for 5 minutes before you do it. Then see if you can go for another 5 minutes. And so on, till eventually the feelings that you need is over. Talking to someone is often the first step to getting out of the cycle. It's not easy to talk about your self-harm and the reasons for it, and you might find it tough. Many young people who self-harm find it difficult to seek help. However, it is a critical step on the road to healing and feeling better. It takes bravery and courage to tell someone about your self-harm. It can be a big relief to be able to let go or at least share such a secret. Never be hesitant to seek assistance whether and however you require it. It's not a show of weakness to express your emotions. It demonstrates that you are in charge of your health and are taking the steps necessary to maintain it. It isn't always easy to express how you are feeling. If you can't think of one word to describe a feeling, use as many as you need to illustrate how you feel. Talking can be a way of coping with a problem you've been carrying around in your head for a while. Feeling listened can help you feel more supported. And it works both ways. If you open up, it might encourage others to do the same. There are a lot of people you can talk about what you are going through. It is important to tell someone you trust and feel comfortable with, as they will be able to help and support you. There are no rules about how you should tell someone. The most important thing is that you feel comfortable and trust the person you decide to tell. Set time aside to talk to them. Remember, you can set the pace, and it is up to you how much you want to tell them. If talking about this is too tough for you, you can inform someone in writing or via email. You can even enlist the help of a friend to contact a responsible adult on your behalf. Let them know you need help with how you are feeling. There is no need to give details about how you harmed yourself, and you don't need to talk about things you feel uncomfortable about. Try to focus on the thoughts and feelings behind your self-harm rather than the behaviors. It is possible that you'll feel worse after informing someone. That's quite typical, but keep in mind that once you've overcome this obstacle, there is support and assistance available. When you're ready to seek help, there are a variety of support programs and treatments available. There are professionals who will listen to you and assist you in developing solutions and plan to deal with the issues you're facing. Cognitive behavior therapy, or CBT, for example, focuses on developing coping methods and problem-solving abilities and has been shown to be particularly beneficial in reducing self-harm. Other types of therapy, such as psychodynamic therapy, can assist you in identifying the issues that are giving you discomfort and contributing to self-harm. It's critical that you speak with a trustworthy health professional who can assist you in determining the best treatment option for you. It's crucial to keep in mind that you won't constantly feel the same way. With aid and support, the issues that are causing you to self-harm can become more bearable or even disappear with time. Things can and do improve. Others indicated that recovery involved learning new coping methods and more effective approaches to dealing with emotions and suffering. This is also a critical component of self-harm healing. Remember, self-harm isn't a suicide attempt or a cry for attention. However, it can be a way for some people to cope with overwhelming and distressing thoughts or feelings. Self-harm should be taken seriously, whatever their reason is.
Alienation, low self-esteem, and anxiety are all issues that require psychological help, and while all three may seem like individual problems, we can actually view it as a cause and effect. What exactly is alienation? Alienation is a phenomenon wherein a person detaches themselves from society and isolates themselves from other people. It is characterized by a strong feeling of isolation and loneliness. While this may seem like a rare occurrence, alienation actually happens quite often. Detaching yourself from your environment and own emotions isn't a good thing, and this is why alienation needs to be noticed and addressed as soon as possible. What are the causes of alienation? So, alienation is caused by a variety of reasons. Health problems such as anxiety, post-traumatic stress disorder, OCD, chronic pain-driven conditions, and self-stigma. These are capable of causing alienation. Also, there are a number of social and other factors that could trigger alienation. For social factor is a change in environment such as transferring to a new school or workplace. Other factors include bad work quality in comparison to peers, a hard time adjusting to new coworkers, bullying, and changes in comfort zone. Why do we need to treat alienation? Being alienated could lead to a variety of problems, including drug abuse, alcohol abuse, eating disorders, constant anger, criminal activity, and in severe cases, suicide attempts. So how do we treat alienation? Treating alienation requires you to find the source behind the phenomenon. Alienation caused by psychological pain will require help from a mental health professional. Also, a sense of purpose is going to be extremely useful, especially for adolescents. A sense of purpose makes you feel empowered, thus allowing you to adapt and find your place in society. So, how exactly does this connect with anxiety and low self-esteem? Before we talk about that, let's talk about what these two things are. Self-esteem refers to how you view yourself. Essentially, it is a value you place on yourself. There's nothing wrong with evaluating yourself and your actions every now without even looking at your positive side will lead to a terrible self-image, thus causing you to put a little to no value on your being. A lot of things can cause low self-esteem, including struggling to fit in with society. This makes you feel lost and makes you wonder if you actually have a place to express yourself. Also, not meeting your parents' expectations and negative comments directed towards Signs of low self-esteem include saying negative things about yourself, thinking that other people are better than you, focusing on your mistakes instead of your achievements, feeling sad and worthless, and avoiding to try out new things due to the fear of failure. Noticing and focusing on your strengths could help you improve your self-esteem. Also, learn how to celebrate victories regardless of how small they seem. Low self-esteem causes alienation because it makes you fear failure. You fear rejection and negative comments, so you end up choosing to detach yourself from society. What is anxiety? Anxiety is characterized by an excessive feeling of uneasiness. Feeling nervous is a normal part of human life. However, constant and intense anxiety could eventually turn into a medical condition. Stressful situations trigger anxiety, such as having a presentation or financial problems. However, a rough past could also be the reason why you have anxiety problems. Stress, trauma, and abuse could lead to anxiety problems. So, how can we deal with anxiety? Stress management and relaxation techniques could go a long way when you're dealing with anxiety. In severe cases, however, counseling and medication might be required. So, how does anxiety cause alienation? Being anxious during social interactions could make it harder for you to interact properly. Being rejected or made fun of in the past might have worsened your anxiety, and as a result, you're now having a rough time interacting with people. This could cause you to avoid social interactions altogether.